Welcome to my world. Another day, another time, another period for knowledge acquisition. Knowledge is power, health is wealth. Today's topic has to do with trichomoniasis role in prostatitis. These are two terms that are very strange to some people, and some are very familiar with it. Trichomoniasis has to do with the infection with Trichomonas vaginalis, and it's very prominent, very common with women, especially women, promiscuous women, and is sexually transmitted to men. But the problem is when men when men have this trichomoniasis, it is not very prevalent. You cannot clearly diagnose it that yes, you have to do so many other strain tests that will bring it out. But in women, it's easily diagnosed by just the well preparation that will show it clearly as women, and it's been incriminated in so many things, even suspected to be involved in the cervical cancer for women. And the same thing with men. Now, the area of concentration is prostatitis, as it is now affecting the inflammation of the prostate, because the transfer to men either affect the urethra or the epididymis or the prostate. So the prostate affection is where there is that confusion, and that is where I want to expose the role of trichomoniasis in prostatitis, and which may even degenerate further than that. So hook on to my channels and stay hooked as I expose everything on the slide section. The objective: to expose the role of chronic trichomoniasis in prostatitis that usually lead to benign prostate hyperplasia and probably even to cancer. The introduction: some of us are not used to terms like trichomoniasis. So trichomoniasis is the infection caused by TB, Trichomonas vaginalis, a flagellated microaerophilic protozoan parasite that is often found in the vagina of promiscuous women, producing grayish-white discharge as a result of the inflammation of the area with very fishy odor. It's seriously discomforting. Yes, this is a colored picture of Trichomonas vaginalis, very attractive, but don't want it. Prostatitis, on the other hand, is a male problem. This means the inflammation of the prostate gland, including swelling. Usually when you talk of inflammation, you talk of redness, swelling, tumor, and what have you, either as a result of the injury, infection, in this case, Trichomonas vaginalis itself, or of unknown etiology when we talk of the dihydrotestosterone. It is in man only because women don't have prostate gland. When not treated, it enlarges further to benign prostate hyperplasia that may eventually graduate to prostate cancer. What you see on the left is the bladder and the prostate gland, but on the right you see the bladder, but the prostate gland is now swollen and so constrict it narrows the passage of urine down to the urethra. So that is exactly what prostatitis is all about. Now let's talk about Trichomonas vaginalis. We call it TB in women. The signs and symptoms you see, it is sometimes asymptomatic, but most of the time it's symptomatic. It's itchy, you feel itching, the grayish white discharge, fishy odor, and easily treated with metronidazole, that is used for almost anaerobes and flagellate parasites. Yes, let's look at the male anatomy, sex anatomy. You see the penis, and the urine passes through the urethra. That narrow part is where it's constricted when you look at the prostate. But looking along, you will see that the epididymis, vast difference, are almost connected with the vesicle that passes through the prostate gland, and from there, the infection of prostatitis goes from urethra to the epididymis, causing epididymitis, and the prostatitis when it stays and infects the prostate gland. According to WHO, in 2020, there were approximately 156 million new cases of Trichomonas vaginalis infection amongst people, both male and female, aged 15 to 49 years old. Trichomoniasis in male is often asymptomatic and associated with increased risk of epididymis, prostatitis, and decreased sperm motility. So this is a serious consequence of promiscuity of most male, because it's asymptomatic, you may not know that you are gradually even destroying your sperm motility and your reproductive capability. If you are in doubt, that's the references you can check. The laboratory diagnosis. The most common one is the wet mount, where you do wet preparation, put it on slide, examine under the microscope. There is also culture that will take almost 7 days, but special medium. And the serology using rapid antigen would also show. But before then, there is also the possibility of staining. The appearance will be just as is in this slide. The nucleic acid amplification test, which is common with a PCR, for characterization and specific identification would help, especially with the male diagnosis, because it is always very difficult to diagnose trichomoniasis in male. And there are laboratories that are very capable of really doing this identification. Now to the conclusion. Like I said, inflammation is a serious area. Inflammation, if acute, is good. It's a good response to a life-threatening situation. The body really perfects itself to protect and sustain life, because you are protecting every organ, every cell in the body. But when this inflammation becomes chronic, it turns to another thing. It involves diseases process that are not necessarily helpful, like autoimmune diseases, lupus, and even cancers. And that is where the problem is. So it is also been indicated in the obesity cancers. Those who are obese, that inflammation really starts that process of the cancer they suffer. So we must be more aware as men. Men should be more aware and know that the danger in promiscuity is a serious problem, because you won't know what is destroying you until when life is gone. Thank you. Yes, for further studies, you can watch more of my videos, and these are the references you can also go and read and know more about these problems of inflammation and other chronic inflammation. So if you like everything, watch more of my videos on this channel, has Akinola-Anjou video on YouTube.